Did you know that constantly labeling your child's sleep issues as just another regression might actually mask a treatable medical need? Today, we are going to stop guessing and start knowing. Welcome back. If you are exhausted, confused, or feeling like you're doing something wrong because your baby isn't sleeping through the night, take a deep breath. You are in the right place. We're Three Koi Fishes, a team of parents with over 80 years of combined parenting experience. We dive into pediatric guidance, research it, and share what parents really need to know. Today we are talking about the sleep red flag hybrid. This is about differentiation. How do you tell the difference between a totally normal developmental regression, which is actually a sign of brain growth, and a potential medical or developmental issue that needs support? You are the expert on your child. But sometimes, the noise of the internet makes it hard to hear your own intuition. By the end of this video, you will have the data and the confidence to know when to ride the wave and when to call the doctor. Defining normal, the data you need. First, let's look at the evidence. We need to dismantle the myth that good babies sleep 12 hours straight in a silent room. That is simply not the reality for the vast majority of families, and believing it can make you feel like a failure. You aren't failing. Let's look at the numbers. According to CDC data published in 2021, 40.3% of U.S. infants aged 4 to 11 months sleep less than the recommended 12 hours. That is nearly half the population. If your baby is sleeping less than the books say they should, they are statistically in very good company. And for my breastfeeding parents who are told that nursing to sleep is a bad habit, listen to this. A 2024 study from the PMC found that among breastfed infants aged 6 to 12 months, 96.8% woke up at least once during the night. Almost 97%. That means waking up is not the exception. It is the biological norm. Furthermore, a landmark study in pediatrics by Jody Mindel and her colleagues in 2012 showed us that 10% of infants have persistent sleep problems at 6, 12, 24, and 36 months. Why am I telling you this? Because before we can identify a red flag, we have to stop pathologizing normal infant behavior. Waking up to feed, waking up for comfort, or having periods of disrupted sleep, this is often just your baby's unique wiring doing exactly what it's supposed to do to keep them safe and fed. The anatomy of a regression. So, if waking is normal, what is a regression? I want you to reframe this word. We call them regressions, but they're actually progressions. When your child's brain is downloading a new skill, like rolling, crawling, walking, or talking, their sleep systems often go offline temporarily. Think of it like a computer update. When your phone updates its software, you can't make calls for a few minutes. When your baby is updating their brain to learn object permanence or motor skills, they can't sleep as soundly. In a typical regression, you will see a sudden change in sleep patterns that lasts anywhere from 2 to 6 weeks. You may notice your child practicing new skills in the crib, such as rocking on their hands and knees or babbling, as well as other changes like increased hunger or a greater need for connection. However, the child is generally happy during the day. They might be tired, but they aren't in pain or in distress. This is where you're in the driver's seat. You know your child's temperament. If the sleep disruption feels like a software update, it's likely a regression. But if it feels like a system crash, where the child is miserable, in pain, or inconsolable, we need to look deeper. The red flags, medical and physical. This is the core of our sleep red flag hybrid approach. We need to look for physical markers that tell us this isn't just a brain update. Here are the critical questions to ask yourself. Red flag number 1, breathing issues. Does your child snore? Mouth breathe? Pause in their breathing? Society often jokes that a snoring baby is sleeping deep. This is a myth. Snoring, consistent mouth breathing, or gasping are red flags for sleep apnea or airway obstruction. This disrupts sleep quality, meaning even if they are in the crib for 12 hours, they are exhausted. If you hear snoring, record it on your phone. Play it for your pediatrician. Red flag number 2, physical discomfort and movement. Is your child arching their back? Are they thrashing wildly? Normal movement is one thing, but arching the back often indicates reflux or silent reflux. Laying flat hurts. So they wake up not because they miss you, but because they are burning. Also, look at their legs. Are they kicking rhythmically? Low iron levels, ferritin, are surprisingly common in toddlers and can cause restless leg syndrome, which makes it physically uncomfortable to stay still. Red flag number 3, skin and gut. Is there eczema? Is there mucus in the stool? Food intolerances or allergies often manifest at night. A child who is itchy or has an upset tummy cannot sleep. If you see these signs, sleep training is not the answer. You cannot train a child to stop having reflux or to breathe through an obstruction. You have to treat the root cause. The neurodevelopmental perspective. Now, let's talk about neurodiversity. When you're building your support team, look for neurodiversity affirming care. This means finding therapists and doctors who don't want to make your child less autistic or less active, but instead want to work with their unique wiring. Children with ADHD or autism often have different circadian rhythms. Their bodies might not produce melatonin, the sleep hormone, at the same time or in the same way as neurotypical children. A regression that lasts for months and months, combined with sensory-seeking behaviors during the day, might be a sign of a different neurotype. For example, some children have high sensory needs. They need deep pressure or proprioceptive input to calm down. A standard cry-it-out method might be traumatic for a child who is literally unable to regulate their nervous system without support. Did you know that some therapies are designed to stop stemming the very thing that helps your child stay calm? If we strip away their coping mechanisms during the day, their sleep will suffer at night. If your intuition says, "My child isn't just being difficult, my child is struggling to settle," believe that voice. You're the expert. Your action plan. So, how do we move forward? Track the data. Keep a log not just of sleep, but of red flags. Snoring, arching, mouth breathing, skin issues. Trust the biology. If your 8-month-old is waking to feed, look at the stats. They are likely in the 96% of normal. Don't let social media pressure you into fixing what isn't broken. Consult with confidence. Take your observations to your provider. Say, "I am concerned about my child's airway because I hear snoring," or "I suspect physical discomfort because of the back arching." You have the right to ask for a referral to an ENT, a GI specialist, or a sleep study if you feel something is missed. Conclusion. Parenting is the hardest job in the world, but you are doing an incredible job. The fact that you are here, learning and researching, proves how dedicated you are. Trust your gut, trust your knowledge, and remember, looking for the why behind the behavior is the most loving thing you can do. If you found this information useful and want other parents to know, please hit the subscribe button to help grow the channel. Thanks for watching and see you in the next video.